Hey, this is Rick Kaselj from exercisesforinjuries.com. I wanted to go through another knee replacement exercise that I end up giving my clients and recommend. If you missed the first exercise, there should be a link above or down below that'll take you to that first exercise when it comes for knee replacement. Now let me go through the second one. With the second one, you're going to need two different types of balls. A larger stability ball. For me, this is 65 centimeters, and then you can end up it could be a kid's ball or a Pilates ball will end up working fine. So I'll show this to you from two different angles, but I get the individual to sit down, and if they don't feel comfortable sitting down in a 65 centimeter ball, it's too deep for them to squat into, I can end up utilizing a 75 centimeter ball or an 85 centimeter ball that'll decrease how much knee flexion and hip flexion is needed to get into the exercise. So I can end up doing that. How I have them sitting is, I have them sitting at whatever range that they feel comfortable with. A lot of people will end up being like 90 degrees. I've got them sitting on the ball. I've got the knee in line with the hip, the knee in line with the foot, knee in line with the hip, knee in line with the foot. And now I'm going to take the ball, the small ball, and place it in between the knees. And then what I'm going to get them to do is squeeze a little bit. Things that I want them to watch out for is with the little ball, I don't want it to be pressing up against any painful areas, any sensitive scars. So they would end up adjusting it. They can put a little higher up their thigh, or they can end up putting it between their knees. If they put it a little higher up, they can avoid those painful or sensitive areas, and then they end up working the adductors more. So I'm getting them to lightly squeeze the ball, and what that lightly squeezing the ball does, it ends up activating all those adductors and growing area, so more abdominal inner unit muscles. And then the next thing I want them to do is rock forward and rock back. So they're maintaining that pressure, they've got good upright posture, and then I'm getting them to rock forward, and then I'm going to get them to rock back within pain-free ranges of motion when it comes to the knee. What I would end up starting off with is one set of 5 repetitions, and then I would end up progressing to 10 repetitions, one set of 10 repetitions, and then 2 or 3 sets adding to it. Really trying to focusing on increasing number of reps that they end up getting doing this. After they end up doing the 5 repetitions, they can take a break and the exercise ends up being done. Let me show it to you from the side. So I'm having a seat, knees and feet are hip width apart, putting the ball in, squeezing the ball, holding that ball in between my thighs, moving forward and back. If there's any concern about balance, I can get them to put a hand on the railing or a hand on the wall. And they're going to the point that they can pain-free, coming back to pain-free, and going back and forth and pain-free. So the ball ends up working the hips, the adductors specifically, also the more of the deep core muscles, like inner unit muscles, and then we end up working on flexion, extension of the knee, and also when it comes to adduction, it ends up working on vastus medialis obliquus or VMO. So there you go. This is Rick Kaselj from exercisesforinjuries.com with a second knee replacement exercise for you to give a go if you're recovering from a knee replacement, or you can end up getting your client to go through it. Make sure you watch the other video that I went through on my YouTube channel when it comes to knee replacement. If you're looking for more information on knee replacement and exercise, or other exercises for other injuries, make sure to swing by exercisesforinjuries.com. Also make sure to subscribe to this YouTube channel. Subscribe button is above. And if you're looking for a knee replacement program to help you get back to pain-free and recovering from knee replacement so you can get back to enjoying and living your life, you can look at the program that I use, and it is at kneereplacementhandbook.com. So there you go. This is Rick Kaselj from exercisesforinjuries.com and kneereplacementhandbook.com saying take care and bye-bye.